Hey everybody, we're here at Injury Concepts page on my website, bodydoc.net, and today we're going to talk about upper neck pain patterns. So we're going to keep this really focused here. I've seen over the years two sort of broad areas of neck pain, upper and lower. Today we're going to focus on, there's a little bit of bleed over here, but mostly we're going to talk about the types of conditions associated with problems of the very upper neck. A quick review of the anatomy is going to show a couple of things. You got your skull. And my ability to move my head this much is all coming from just my skull that sits upon the cups of my first vertebrae, the atlas. So my atlas bone, my first vertebrae, has two concaved cups. And the condyles, as they're called, of my skull sit within them. And as those condyles glide in that cup, it allows me to do this. The musculature that moves that is called the suboccipital group. And then various muscles in the front of the body, like platysmal would be one of them, the deep neck flexor would be another one, that actually take my head and move it back and forth. What do you see is patterns in this area though. Probably the most common is going to be maybe a locked up. So in chiropractic, there's actually an entire branch. The son of the developer of chiropractic, B.J. Palmer, actually popularized a technique called hole-in-one adjusting. Hole-in-one is a focus upon the C1 vertebrae only. Oftentimes when I'm palpating a patient and they're dealing with upper neck pain, I will lay them on my table and I'll slightly extend their head to lax those outer muscles like upper trapezius, which is a really big one that starts at the base of my skull here and comes over. And you'll see in some pictures that I have here on this video that an upper trapezius is a very large sheet-like muscle and it's really strong and thick. So in order for me to get underneath it, I'm going to have to lax your head and extend it backwards slightly, and then my fingers can get up and deeper inside there and actually touch those muscles. But the suboccipital muscles oftentimes are in a slight spasm, and that first vertebrae won't move. And what B.J. Palmer thought and saw was that if he could help correct the alignment of the skull and that first vertebrae by a mechanism called cervicokinetic reflex, you would have a cascade, almost like a domino effect, where once I get that first vertebrae aligned and the tonus of all the muscles is nice and normalized and equal, then the skull and the first vertebrae, along with what they call the writing mechanism, which is heavily influenced by my eyes. So my brain is always wanting to sort of be square like I am with this camera right now. And in order to do that, I can even know I'm square by closing my eyes. I know where I am. The proprioception, that's very heavy right along the same area here, has a very powerful influence on the tonus of the rest of the muscles, the postural muscles that go down the spine. I personally don't see a lot of connection between the upper cervical and, let's say, mid back pain or low back pain. There are many that postulate that there are strong connections with this, and I'm not going to address those issues in this particular video, perhaps in one more about chiropractic specifically and the HIO adjustment specifically. But I will say this. A tremendous benefit of adjusting the upper cervical spine is to relax the tension state where those two bones, either it be CO, which is the skull, and C1 or C1, C2 are locked and not move. And you feel this quite often. It's quite obvious when I get underneath there and I palpate and I try to assess whether or not somebody has an upper cervical problem related to the symptoms that they came in, and we'll go over that. I want to get my hands in there and find out if I feel restriction of those joint lines. And oftentimes when I release that restriction using adjusting tools like lateral glide adjustments or rotational based adjustments, I can affect a tremendous amount of change in both the movement of those joint lines to get them moving again, but also the tonus of the musculature, like the suboccipitals here, that tend to go in a bit of a spasm when those joint lines are out of place. What kind of symptoms? Well, the most obvious upper neck pain pattern is going to be pain in the upper neck. You're going to feel this right at the base of your skull. It's going to feel locked, it's going to feel tight, it's going to feel painful, it's probably a bit inflamed, it's probably a little bit tensed out. This can happen in the gym if you're straining doing a bench press if you're straining doing a pull-up, a Y base, and you start doing those types of motions where you're shrugging and you're crushing your skull down towards your thoracic spine, you're going to affect, by virtue of that, the head is going to be caught in some place and jammed together. So you see this quite a bit in the gym setting. You might find this doing sit-ups if you're taking your head and you're pulling while you're doing a sit-up. And so working a proper form on that so that you're moving your whole body and your head is not being pulled forward by your own hands. But upper cervical pain patterns might also include headaches. Quite often, tension-based headaches are originating from the upper cervical spine. So again, outcome measures are important with this one. Headaches is a big subject, and I wouldn't purport to only use upper cervical adjusting to cure headaches. One, I would have to be able to reproduce those headaches by palpation. And so if a headache is actually originating from the upper cervical spine, I should be able to almost reproduce that headache by pushing in either through those suboccipital muscles here or by doing lateral glide assessments with my fingers on the bones themselves, on the joint lines. Other upper cervical syndromes that you see right now, quite common in our culture, is looking down at phones. This ubiquitous look like this. So the ubiquitous use of devices today is leading to some interesting upper cervical pain patterns. One of them, of course, is constantly looking down with a phone in our hand. That puts a tremendous amount of chronic postural load on both the muscles here that serve to take the head back the other direction, but also that I don't have pictured here is the ligamentous system, a series of ligaments, the ligamentum nuchal ligament being one of the largest of them and most powerful, which starts at the base of your skull and runs down the spinous process down the center here. So anything to do with looking down or rotating the head and causing pain is one of the pain patterns that's most common and most of you guys would identify with. The skull and C1 allow flexion and extension, or looking up and down. And then C1 on C2. Now C2 has a bony projection called the odontoid process. C1 wraps around it, and it literally rotates about the odontoid like a pivot. So rotational movements are primarily associated with the C1, C2 vertebrae. Skull sitting on C1 and C1 in the skull rotating about C2. The rest of the vertebrae from C3 all the way down to C7 perform the rest of the rotational abilities that we have, and of course the rest of the flexion and extension abilities that we have, and almost all of the lateral. There's almost no lateral flexion taking place at CO, C1, C2. So you're generally not going to find that lateral flexion would cause any of the pain patterns there, unless of course there was a slight separation or jamming of muscles or something on the side of the tilt. But most common patterns here are going to be headaches and localized sharp grabbing pain or dull achy pain in the very upper portion of your neck, just below your skull. The most common causes of that are going to be vertebrae that are slightly locked from poor sleep postures, poor computing postures, device usage, and strains in the gym or in sports that involve using the other broader muscles that move these parts, like tennis players looking up, weight trainers doing straining, and various other ways. Anything that involves those types of strain motions can lead to upper cervical pain patterns. So, hope you learned a little bit about your upper cervical spine today, how the skull, C1, C2 articulate, how the ligaments tend to be a deep support for that, and how some of the musculature like the suboccipital muscles play a role. The last thing I'll say about this is that at the C2 vertebrae here, at the outside of my second vertebrae, lies a muscle that has a combination of both an upper cervical pattern and a lower, and that's the famous levator scapula muscle that originates on the transverse process, which is the bony projection out to the side, all the way down to your shoulder blade. So again, another link with that shrug effect of a bench press, a push-up, poor form and a shrugging, jamming motion while doing pull-ups. I see quite often, maybe sometimes on dips, but definitely on push-ups and cable pull-downs or pull-ups. So be careful of those things, identify those problems. In some other videos we'll talk about how to fix those problems, okay? Take care.